Well, good morning and welcome to the third floor City Hall. I'm Larry Holsey, Director of Municipal Information for the City of Waco, and we will thank you for joining us this morning compared to yesterday afternoon. We had to postpone yesterday because of a little storm that came through. Lost some power throughout the city, and that was going to impact it, and we appreciate you joining us again this morning. These are very informative, informational press conferences that we have. We're doing it virtually, again, from the third floor of City Hall. There's only 4 people in this room, and downstairs we have our American Sign Language interpreter as well as the Spanish interpreter who is doing a full audio version of this that will air again this afternoon on our cable channel and our live stream this afternoon at around 4:30. And again, to introduce that to our Spanish speakers and give the proper welcome and invitation for that is our City Council member for District 2, Hector Sabito. Mr. Sabito?
Thank you, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Thank you so much, Larry.
Thank you, Councilman Sabito. Joining me again today are our 3 regulars that have been really trusted, and their responses are always greatly appreciated. Our mayor, Kyle Deaver, and our county judge, Judge Scott Felton, and Dr. Jackson Griggs, who is the CEO of the Family Health Center and also co-chairs the Waco McLennan County Public Health District Advisory Board, as it is. Gentlemen, always thank you for being here. We're going to do the same thing we've done before. We're going to let each one of you have an opening comment. Then we'll go to the questions that I have that I've collected throughout the community. Then the mayor will conduct the press interviews with. We have 3 media representatives on the phone here in the room, and then we'll move from there. So let's get started. Mayor, if you'll start us off with your opening comments.
Thank you, Larry. I appreciate everybody being here again this morning. Again, apologize for the delay from yesterday, but we had some technical issues with the weather. I want to start off by sharing some data with you that I have shared for the last several press conferences. So let me just get into that right now. This first slide shows our cases, total cases for the COVID-19 in McLennan County. We had a little bump last week with 2 days in a row of 4 new cases, and then we had 5 new cases this past Monday. Our curve still continues to be relatively flat, and I'm pleased with that. I think we've got to expect to have some new cases as we go along, and particularly as we're testing more, and we'll talk about that. Let's see if I can make these slides advance. There we go. This is hospitalization in McLennan County. Still continues to be very, very low. We've had, for the last 3 weeks, not more than 2 people in the hospital. A lot of days we've had no hospitalizations and only 1 ICU over that same last 3-week period. So doing very well there. This next slide shows the rolling 7-day average of the Texas positivity rate. As we reopened our economy, there was concern. This is the data. This is the main piece of data, along with hospital capacity, that the governor says that he is watching as he reopens the economy. And so far, so good. I mean, it's hovering at about 5.5%, down from where it was when he first announced the reopenings. So this is really good news for the state. There are still some hot spots in Texas that are of concern, but overall, as a state, doing very well. And then this last slide is McLennan County's positivity rate, rolling 7-day average. And again, this is total positive tests over total tests completed. And by completed, we mean we have received those results on those tests at the health district. You can see that we bumped up a little over 1% in the past few days. We were down at an extremely low, about 0.25%. That is probably not sustainable as we go forward. But we're still very low, about 1%, where the state is about 5.5%. So I'm still very pleased and very appreciative to our businesses and our citizens who are doing all the right things to keep that rate low. One other thing you may notice on this slide is it looks like that testing has declined over the last week or so. That's really not the case. The deal with this graph is that those numbers don't show up until those test results come in. And there has been a significant delay that has started to develop with many of the labs, if not all of the labs in the state, both public and private. And so we'll talk more about that later, but that's the reason that those numbers for total tests, those blue bars, are going down, because we're waiting on results. We're waiting for about 200 results right now from the labs. So with that, I will turn it over to Judge Felton. Thank you.
Okay, good morning, everyone. Well, I'm cautiously optimistic as we move forward, and the economy is opening up quite a bit more, which will give us a little bit more risk that we're going to have to deal with. But I think all in all, it's a positive for the state of Texas and Central Texas especially. The things that we watch, and I know some of the questions probably will be around this, what do we look at to make decisions locally, or suggest to the governor things that we need to be looking at locally. And the positivity rate, of course, is one of them. And we will be increasing testing as we have been in the past, that Dr. Griggs will talk about. But as long as our positivity rate stays fairly steady and well below the state average, I feel pretty good about it. The other thing is the hospital capacity. And those are, we talk every day to the hospitals and the Family Health Center about capacity and, what our strengths would be to handle any kind of additional influx in there. I think the thing that concerns me the most is the lag in time that the tests are coming back. And, we're reaching out statewide to try to get that improved. And I think we've just moved faster than the labs can handle it in testing, but they're going to have to catch up. We don't know their own testing. As I said, I'm cautiously optimistic, and I'm looking forward to answering any questions that might come up. Thank you.
Dr. Griggs?
Wonderful. Well, thank you again, both Mayor and Judge, for allowing me to participate here with you today. I'm going to start with worldwide case counts, and then talk about our country and state, and then briefly touch on a few things pertaining to our county. Worldwide, 5.7 million cases, 356,000 deaths to date. The United States, 1.7 million cases, and a somber threshold that we crossed yesterday was the 100,000 deaths in the United States due to COVID-19. And there doesn't seem to be any end in sight in terms of the death toll. In Texas, the Department of State Health Services indicates 58,000 cases reported in Texas, 1,562 deaths in our state. And in terms of Texas trends, the week of May 10th, the incidence was up in large part due to new cases in the Panhandle and the meatpacking industry. But this past week, the week of May 17th, the new cases came back down to closer to about 1,000 new cases a day. Saying that, our RT, that's our effective reproduction rate that we've talked about before, that RT has crossed the 1.0 threshold. It's now 1.01, which is among the states, it is the fifth highest right now. So our infectivity rate, which is based in large part on health behaviors, is creeping up. So this does create a little bit of concern for additional spread in Texas in the upcoming weeks. Thank you, Mayor, for offering some insight into our status in McLennan County, and so just to maybe add a couple more items. The health district's monitoring 51 individuals right now. There are 14 active cases and a total of 113 total confirmed cases. Again, 0 hospitalizations at this point. And we've not had any new deaths, so four deaths total. In terms of testing, and this is tests, I have data up until Monday, so this is a couple days outdated here, but total tests completed as of Monday, 6,509 tests on McLennan County residents and 8,200 tests performed by all of our McLennan County healthcare entities. We still don't have any cases in the jail, and as of yesterday afternoon, no cases in McLennan County nursing homes, which again is so important because a third of all of the deaths in the United States have been in nursing homes and long-term care facilities, and 40% of the deaths in Texas have been in those settings. So we'll keep close track of that setting in particular.
Okay, let's get started with the questions. Some political figures of late, including a local candidate for public office, have raised concern about city and county orders here and elsewhere as being constitutionally dubious, or at least constitutionally questionable. Mayor Deaver and Judge Felton, how have each of you taken steps to ensure that public safety orders and declarations are truly constitutional?
Judge, I'll start on this and then see if you have a follow-up. Larry, I'm a lawyer, but I'm not a constitutional scholar. But what I do know about the Constitution tells me that there's not anything unconstitutional about what we have done. We have certainly talked extensively with our city attorney and other experts to be sure that what we were doing was constitutional. I would be curious to know what kind of constitutional challenge these folks are asserting, because just saying something is unconstitutional is hard to address. We really would need to know what part of it they think is unconstitutional and under what part of the Constitution. So without knowing that, I don't want to speculate further on that. Judge, you have anything to add to that?
No, I think you pretty well covered it. Unfortunately, during political season, people who aren't well known want to be well known by saying something that's stupid. So that could be the source of that. But we very much want to do things according to the Constitution and the local laws. And my approach on this is more try to go out and educate folks rather than take a heavy hand. But we will see how that goes. Thank you.
Okay, Dr. Griggs, the wearing of masks seems to have become a political or cultural issue these days, even as both Republican and Democratic governors and other nationwide encourage their use in reopening American economy. Is there anything you can stress to reinforce the argument that wearing a mask is really all about our concern for the other guy or not yourself?
This question brings up some really important issues about health behaviors and the politicalization of health behaviors. And I mentioned my own concern about this maybe 2 or 3 weeks ago when I was first starting to see this occur. So I'm going to spend a couple minutes addressing this. Let me start by saying I have seen such tremendous goodness in our community as people have put aside their own preferences and impulses in order to care for others. Perhaps the greatest gesture of our American freedom is to freely act in kindness for someone else, not because we've been coerced or forced to do it, but out of freedom, we love our neighbors. And I've seen, of course, so much of that. Masks have been sewn, meals have been prepared, charitable giving has occurred all around, and out of freedom, people have cared for others by staying physically distant and by wearing masks in order to protect the vulnerable. So our society has really come together in a beautiful way, and as political forces tend to do, it's currently threatening some of that togetherness and some of that unity. And so we have, I think, a choice to make as a community. Do we let our individual political alliances divide us, or does our community value sort of unified loving kindness more than it values donkeys and elephants? As a physician, I don't care which side is saying what about masks. Science and epidemiology is by nature apolitical. It doesn't take sides. And of course, the virus doesn't care how you vote, and it just wants to infect more cells, more people. And along the same lines, our health behaviors are emblematic of how informed we are on public health and how much we care about our neighbors, not emblematic of how we vote. And in this moment, when community stakes are high, we cannot be duped by propaganda from either political side. Wearing a mask and physical distancing is about keeping your mother and my mother out of the hospital and off a ventilator. And that's what matters.
That is so well said, Dr. Griggs. I really appreciate that message. I hope everybody will listen to that.
Okay, I agree with that. What size of spike would be considered severe enough for local leaders to talk to the governor about closing businesses again? And during the previous conferences, no specific number or statistics has ever been cited.
Judge Felton, would you address that, please?
Well, as I said in my opening comments, the things that we try to watch the most is the rate of infection, but also the capacity that the hospitals have to handle, any surge that we might have, and not just the hospital rooms, but also ICU and all the equipment's needed to deal with those more serious side of it. But I think our main effort is to try to concentrate on our local folks and really provide them with more information and reminders and things like that. I see that early on that the businesses are really being responsible and they have more authority because they own the venue that people are coming in, what they may require folks to do to be able to make the other patrons that they have there safe. And so it appears that the more they do, the less chance we'll have in spreading it. The area that I am worried about is more the social setting that people go into and sometimes forget about those safety measures to be taken. And you've seen, where they have the big parties that people took Facebook pictures of and those kind of things. But, I feel like that we're going to take more of the education side and if we need to talk to the governor about things, we will, but I just see that a long way down the road.
Okay. Some people have received tests from the National Guard in Belmead still haven't gotten the results. Is there any more information about that delay, and how will local officials and the public health district factor delays like this into decisions about the COVID-19 response?
Well, I mentioned that a little bit in my opening remarks, Larry. That is a huge problem, and it is occurring with labs all over the state. I will say that we have, as of yesterday, we had received at the health district all but one of those test results back. And out of all those tests that were done, I think it was 260 something tests that were conducted at 3 sites, Belmead, in Waco, South Waco, and then up in West. There was only one positive test result out of all of that. And that person was a person who had previously tested positive and was trying to get a negative test result. It was a healthcare worker and was trying to get a negative test result to return to work, but tested positive again. So all of that testing did not result in any new cases for McLennan County. But the delays at the labs are a significant problem in our ability to respond. We are talking about that on a daily basis and trying to figure out, what options we have to try to get tests back quicker. Some labs are currently producing results quicker than others, but that changes on a fairly regular basis, and it creates huge challenges because we didn't get those test results back on the National Guard testing for 14 days. And 14 days is the length of quarantine that you're supposed to follow. And so there's really no value in those tests at this point. And so we want to try to avoid that whenever we can.
Okay. Speaking of tests, are there any plans for more drive-through tests or testing events similar to the ones at Belmead and South Waco and in West?
My understanding that at this point we do not have anything scheduled, but possibly will before long with the help of National Guard or third parties. But both hospitals now at their locations and some of their outpost locations are having drive-up testing. I think you still, Dr. Griggs, have to qualify, go through the questioning to be able to get a test. Is that correct?
We're testing symptomatic patients. So if you have any symptoms that might suggest COVID-19, then we are testing. The caveat to that, or the exception to that, is in elective operative procedures, surgical procedures, before the surgery. Those individuals are also being tested in order to help determine whether those operations are at higher risk or not.
Right. And, just one other thing to add to that, if there are areas of outbreak, there could be, we could mobilize testing around that too, which we've got the plans for it. And so we'd be prepared when that's necessary.
Larry, one other thing I meant to add on the National Guard testing, we learned in the last couple of days that the National Guard was allowing people to be tested that were not symptomatic, which is not our typical situation, which may help explain why there were so few positive results out of that testing.
Good point. Good point. This one has to do with a lot of what's opening this weekend. If contact tracing reveals someone who tested positive went to a crowded place like Cameron Park Zoo, Hawaiian Falls, or Magnolia at the Silos, what will happen? And this is a three-part question. So what will happen there? And what steps will the public health district take? And will those places be required to take more safety measures or temporarily close?
Dr. Griggs, I know you don't really represent the health district, but can you talk a little bit about what you would expect there?
Sure, absolutely. So contact trace, when there's a confirmed positive, then the health district implements contact tracing, and that involves some thorough interviews of the individual who's positive, including where they have recently spent time. If they have been at a facility like the zoo or the silos or water park, then the questions would be how long were they there? What was their significant exposure? And if there was significant exposure at a place where there could have been potentially a number of contacts, then the health district would make a press announcement with that information. If in the investigation then of the facility, the health district finds that exposures were due to poor safety or health protocols, then the health district would offer feedback. In terms of regulatory authority or closures, I'll have to defer that aspect of the question.
Okay. Any update when city facilities like City Hall, the libraries, the Mammoth site, municipal court, and water office will reopen to the public?
Larry, there's really not a significant update since the last press conference last week. We are continuing to make safety improvements to some of those facilities to help keep employees and the public safer than they would have been with the facilities as they were laid out before this all broke out. So that's just continuing to be worked on, and don't have a definite date, but it will be soon. At the same time, we are continuing to provide all those services virtually and through drive-through and drop-off type procedures. The library continues to offer curbside delivery of books and has a lot of online content for families to use. We're continuing to work with the Park Service, National Park Service on the Mammoth side. Currently, the trail and some of the other amenities, including restrooms and picnic areas, are open, but the dig site remains closed, and we'll continue to coordinate with them on those facilities.
Okay. Judge, what about any updates on about jury trials?
Well, several weeks ago, the Office of Court Administration that pretty much manages judicial side for communities had an advisory that after June the 1st, juries could be called. But since then, I've rethought that, and primarily because all the hurdles that they've run into, they have extended that to August the 1st. Now, they did make a statement in there that they would be interested if certain courts wanted to come up with a plan and present it to them to hold a proceeding prior to August 1st. And I think this is probably a good idea because it lets these courts kind of figure out how to safely put on a trial, and it could be a guide for all the rest of the courts around the state to follow. We are considering that. This morning, I talked to the district clerk, and it's up to our two criminal felony district judges, Judge Strother and Judge Johnson, if they want to, take with our help, put together a protocol to be able to safely hold a trial. All things are on the even to the point of looking at a different venue other than our traditional courtrooms. It could be, another building with big open space, and you just draw off everyone would be with proper physical distancing between those. And, there's still all kind of issues on, how does a court reporter be able to understand the people that are giving testimony as well as passing around evidence. And, we've got to figure all that out, and it's pretty complex. There's a lot of moving parts, but we are working on that. Don't know that if we will present one for approval for prior to August 1st or not at this time.
Okay, Judge Felton, one other one with you. With the reported loss of hotel motel tax income, is anything about the Heart of Texas Fair complex expansion being impacted?
Well, I think future expansion could be, but at least temporarily. But right now, we have adequate reserves to be able to make bond payments for the next couple of years. And, we expect to get some revenue. It's not going to be what it was in this last year, but from the time, during the months of March, April, May, and then probably into June, it's going to be very limited amount of revenue coming in, which is, remind everyone that it's 2% on the hotel tax and 5% on rental car. And there was just an article in the paper the other day about how the rental car business is just pretty much shut down, and renting hotel rooms. But with the economy opening up, we see a lot more people more than likely will be moving around, need to stay over, especially people that are in sales and those things, back out trying to get businesses back going. So, we're all right, but it will impact any over and above revenue that we get over and above debt service that we could put into additional projects. Could be challenging for a little while anyway.
Okay, with the increased opening and relaxing of shelter-in-place orders that have shown to be working, what do our citizens need to do to not let things get bad again?
Dr. Griggs, would you speak to that?
I think it was Elizabeth Kubler-Ross who first kind of defined the stages of grief. There may be similar stages of emotionally dealing with this pandemic, and if that's right, I think we're in the anger, resentment, indignation stage right now. I think we all feel this sense of wanting to kind of shake our fist at this thing. I think it's important that we remember that we didn't choose to have to walk on this tightrope between economic thriving and protecting the elderly and those who have health vulnerabilities and those who are immunocompromised. But in this moment, I think that the things that we have talked about before remain critical, and we beat this virus not through defiance, but again by coming together as a community to care for each other using good public health measures, staying 6 feet away from non-household members, masking in public, avoiding crowds, especially indoors, washing, sanitizing hands often, and staying healthy by getting enough sleep and staying active. Our employers and business owners have a key role to play as well in ensuring their environments keep viral transmission risk to a minimum. And this is a theme that you have heard us continue to voice. It's really something that we all have to be doing together.
Mayor, it looks like the byproduct of the shelter-in-place order that was issued, people have been doing a lot of cleaning out and whatever else. They're wanting to know about garage sales, estate sales. When can citizens have a garage sale or estate sale?
Well, we've talked about the fact that the governor has taken control of this reopening of our economy, and to date, he has not made any announcement regarding garage sales or estate sales. So until he does that, the city doesn't feel that it can issue permits for garage sales and estate sales inside the city. That's something that I think the governor needs to address, and I would encourage people who are, typically hold estate sales for a business to get in touch with the governor's office and ask them when they can expect to open.
All right. On May the 18th, Governor Abbott announced that massage and personal care businesses, including tattoo shops, could open, but he also mentioned youth clubs such as Boy Scouts, Girl Scouts, FAA, and YMCAs could all open immediately. And this summer camps, youth camps, sports camps, Little League games, VBS meetings could all take place starting May 31st. Since many of these programs are all children related, how do we monitor or get the kids to not be the weak link, more or less, to increase the spread of possibly a new wave?
Dr. Griggs, would you mind speaking to that?
Yeah, absolutely. I have a 15-year-old and a 10-year-old at home, and when they were much smaller, they were very difficult to corral. I think that the idea that we can ensure keeping children physically distant that's a big challenge. And so for specifically child care centers, the governor has put a checklist for child care centers on the Open Texas website. That's the governor's website about opening back up the economy. So look for the checklist for child care centers. Some of that information can be kind of extrapolated for other purposes. So it's got rich data there. And for coaches, teachers, camp counselors, I think just recognizing that everyone who's involved with children shares the responsibility for building and implementing protocols to limit the spread of the virus. Again, we're not concerned about the youth or middle-aged folks succumbing to this virus, but they act as sources that spread the virus to those who are vulnerable. So it is exceedingly rare for a child to have complications due to the coronavirus, but they act as an agent that carries the virus from one place to another. And what we're trying to do is keep children who have the virus from infecting their grandparents or their aunt who has had a kidney transplant, or their uncle who is on medicines that cause his immune system not to function normally. So I think in camps and in child care settings, avoid time in enclosed spaces. Staying outdoors is key as much as possible. Keeping groups of children keeping the groups themselves small with high ratios of adults to children so that children can be shepherded from physically clustering, and then keeping high-touch surfaces disinfected. I think those are the three key points that are probably most important.
We're kind of following up on the same thing. The governor has said the more people continue being cautious, the more we can open and get the economy and unemployment back in a healthy level. Do you think this is really the key to a renewed economic success?
To me, that seems like one of the real keys, but I'd like to ask Dr. Griggs to address that also.
Thank you. I'm not an economist, so the real key to economic success isn't really my expertise, but saying that, it does seem clear that our health behaviors determine the degree of the spread of the virus, and keeping viral spread low allows businesses to continue to operate and continue to steadily open. So there's a direct relationship between how we choose to act, physical distancing, masking, et cetera, and if our economy continues to get back operational and begin the recovery process. So I think the governor's statement is accurate if we're talking about those health behaviors that we've been discussing.
Okay, this question.
Judge, anything to add on that?
Go ahead, Mayor.
Pardon me?
I was just asking if you had anything to add on this question.
Well, obviously, there was actions taken that really helped curb the trend, and there's actions taken now to work on the economy, and they're both important. And there's possibly no way that we can open up this economy without increasing the amount of risk we have with spreading the virus. But as many of you know, a bad economy causes adverse health problems and other problems for people as well. It's back to the individual, and so it's just a balance that we will go through. And it's the first time we've all been through it, so it can't really. It's hard to be predictive about what'll happen, but I think we're doing the right thing by opening up this economy and moving forward, and just keep saying, here's what you can do to protect yourself. And back, Dr. Griggs, you were talking about the risks that younger folks have going to camps and those kind of things, and how they come back to and could affect people that are older people. I've got grandkids, and the grandkids are a gift, but they also give you things like cold, flus, stomach virus, and things like that. And so people in my age group and all have to do what we can do to try to let them do what they want to do, but yet we protect ourselves. So it's a balance.
This question came in a little earlier this week, so part of it's already been answered, but we're talking about tourism. Tourism has been a strong contributor to Waco's economy. When do you expect that segment of our economy to start opening up, like the convention center and attractions, so our hotels can start hosting guests from outside of Waco?
Well, it's really going to be happening in the next week for a large part. On Friday, the Cameron Park Zoo will open, and Hawaiian Falls will open on Friday, joining the Texas Ranger Hall of Fame and the Dr. Pepper Museum's attractions that are open. On Monday, Magnolia has announced that they will open their facilities to the public. All of that will bring tourism eventually back to Waco. It'll also get our people, our local citizens, out more, attending some of these places. And it's important for our economy that we do get tourism restarted, and I'm looking forward to that. I think I have seen Magnolia's plans for reopening. They are doing everything that you could ask in terms of trying to keep people safe as they are coming into their businesses. I've seen that with other businesses in town, particularly those that appeal to tourism. And so I think we're going to work on a branded statement that talks about what we need those tourists to do when they come to visit us in Waco. And we want to welcome them, but we want them to behave responsibly while they're here too.
Well, this one's kind of on the same order as well. They're talking about people transitioning and going and traveling and whatever. This one says, I have family in New York City. When is it okay for us to visit? And should we go there or should they come here?
Dr. Griggs, I guess if you don't mind talking about travel risks and what should be considered there.
Absolutely. So first, Governor Abbott issued an executive order on May 21st that terminated air travel restrictions that mandated temporary quarantines for air travelers arriving from U.S. hotspots. So previously, there was an executive order that then has been rescinded. So now there is no required temporary quarantine for those arriving from New York, New Jersey, California, a handful of other hotspots. If I were counseling a patient, my advice would depend heavily on that person's health vulnerabilities and the health vulnerabilities of their household. I would certainly discourage travel to any hotspot and discourage hosting guests if any household members had chronic illness, were aging adults, were obese, or were immunocompromised. If the out-of-state visit were very important and there were health vulnerable individuals involved, I would encourage a period of ideally 2 weeks of quarantine for those traveling from the hotspot before they visit. So again, if I have someone in my household who is obese, immunocompromised, chronically ill, or aging, I would ask someone who has been in an area of a lot of viral spread, I would ask them to self-quarantine for 2 weeks and then make the travel to come see us. And I would certainly encourage them to wear masks in the airport and to use hand sanitizer during the course of their travel. And of course, for all travelers, it's prudent to implement the same guidance we use in any other circumstance: physical distancing, avoiding getting into a crowded spot, particularly indoors, hand hygiene, face covering, etc.
Okay. Did you miss our local newspaper not being published this Monday? How is the public sector planning for the day our newspaper either shuts down or becomes a weekly paper? And will we have these press conferences regularly to keep the public informed?
Well, I didn't miss the newspaper being published on Monday. I get my news from the Waco Trib on my iPad every morning. So I have not been taking the physical paper for several years now. I think that the decline in newspapers across the nation is a real disturbing factor for our society. We have had a lot of newspapers across the country that have shut down. The Trib is on a very reduced staff at this point. And newspaper reporting is so important to get deep dives into issues. The TV stations do a good job of covering the news, but they don't have the time to get into the depth that these professional journalists at the newspapers do. There are professional journalists at the TV stations too, and I don't mean to imply otherwise. They just don't have the time to get into the level of depth. And so I hope that the Trib can find a way to continue to publish on a daily basis, and if not publish on paper, at least publish electronically. And I know that would not be satisfactory to several people, including my brother, who wants to have paper in his hands. But getting the news, getting actual news that has been vetted by a journalist, not just somebody's idea from Facebook or other social media sources, is critical to making good decisions. And so I don't know exactly how government would adapt, our government would adapt to not having a local paper, but it's a very serious question and one that needs to be considered.
Okay, let's shift to the media people who, since we're talking about newspapers and TV stations. Mayor, if you'd like to conduct the media part, we have 3 people on the line right now, and I think they're prepared to go at your orders.
Okay, that's great. We'll start with Joel Lopez from KXXV. Joel, are you on the line?
Joel, are you there? I guess not.
Okay, well, let's try Rhiannon Sagert from Waco Trib.
Hello. My question is about asymptomatic carriers. Do we know more about them now? And with more testing, do we have a better sense of how many there are out there, how many there are likely to be, and who is likely to be asymptomatic? I know there's some evidence that younger people might be, but is there more specific information now?
Dr. Griggs, can you speak to that?
And Rhiannon, I don't have any updates from for you as it relates to the previous comments. I think that my own, as I've been tracking literature, my concern previously based on some smaller groups was that asymptomatic spread was as high as 80%. That may have been a little bit of an overestimate, maybe closer to 50%. But I think that reinforcing the fact that it is common is probably the most important factor to recognize. And among those, you mentioned those who are younger. Yes, I think that the majority of asymptomatic spread is occurring in those who are not the health vulnerable. In other words, it is not the population who is more likely to have symptoms and to become sick. It is more likely the young adults and children who are the asymptomatic spreaders. I think while we're on that topic, I'm going to use the venue just to address one issue, and that is church meetings. I'm somebody of a deep, devoted faith and have been my whole life, and this is a hard thing for me. The way that we have had to sort of spread out and adapt, but I still think that thinking very critically about how we fellowship in places of worship is really, really important right now, in particular. And I think that those places that, particularly those places that emphasize loving neighbor, loving community, want to be very, very careful about not being a place of convening where the virus gets spread and then actually poisons the community as opposed to loving the community. So I think that there is an opportunity to think through how we do church or worship in a way that is consistent with our theologies of loving our neighbors. And I think that it's really important right now, particularly given there's so much asymptomatic spread.
Noelle Mendoza, are you up from KWKT? Are you on the line?
Hi, good morning. So with more businesses opening and more people out and about, why do you think our numbers haven't reached that of neighboring Bell County?
Dr. Griggs, would you speak to
that? My assumption is, without having looked at the numbers, my assumption is that we implemented changes earlier at a community level, and that we may lack some of the areas where there can be rapid spread, or that within those areas of rapid spread, like manufacturing and nursing home settings, I know that we implemented protocols in an anticipatory fashion before we were seeing community spread. My sense is that those things have made such a massive difference. There was some modeling that took place that was published even this last week that said even a week's time difference can account for massive spread. And I think that what happened was that through our city-county leadership, through organizational leadership at some key institutions, some protocols were put into place that has really protected us through this sort of first wave, and I think there's some learning that we can do based on that.
Yeah, Judge, didn't Bell County institute their order the day after we did? So they really were not late there, but I think it's more than the orders. I think it's the way that the community has reacted. And Judge Felton and I had a video conference with the operators of our local meat packing processing facilities on Tuesday. And I came away from that just completely impressed with the way that they have taken responsibility for keeping their employees safe, so that they don't get sick and don't have to shut down. We've had very, very low incidence of infections with employees of those places. That's contrary to what's been experienced in a lot of places around the country, including Amarillo. And they had, as of last week, over 2,800 cases in Amarillo, most of them tied to meat processing plants. But I think the measures that Judge Felton has taken with the jail and his people have taken with the jail have kept us from having a big outbreak there. I think the actions by the pastors have helped us tremendously. So I think there have just been a lot of things that have happened that have been great things that our community members have done to help us keep it low. And we're very, very fortunate with that. I want to check one more time and be sure that Joel Lopez is not on the line. Did we ever figure out whether he was there, Larry?
Joel, are you there? Evidently not.
Okay, well, let's go back and take one more question from each for Rhiannon and Noelle. Rhiannon?
I don't have a follow-up, but thank you.
Okay, thank you. Noelle, any further questions?
Yeah, with these openings affecting the number of people getting tested or getting confirmed with COVID?
I'm sorry, could you say that one more time? I didn't get the first part of it.
Yeah, with these number of openings here recently, are they affecting the number of people getting tested or getting confirmed with coronavirus because there are so many more people out and about?
I would think that, I'll let Dr. Griggs speak to this too, and Judge Felton, obviously, if you'd like to, but I don't think there's a direct tie between the openings and getting more testing. I mean, I think if because of the openings, people start to have symptoms, then that would lead to more testing. But at this point, I haven't seen a correlation. Dr. Griggs, do you have a response to
that? I think that at this point, with small numbers, it would be speculation. I think we'll have to just continue to follow and see what the numbers do in order to be able to really associate the two, particularly in a causal way, which is a really good question. And certainly there's plenty of theory that would suggest that, yes, with more and more opening, we're going to see more and more cases. But to be able to tie the two together scientifically, and we need more time, and we'll have to see more numbers.
Thank you, Dr. Griggs.
Our efforts to increase testing have been there for a long time. It was just the ability of the getting the test, having the workforce to do it, and so I want to. We're so fortunate to have a medical community like we have here that's really pushed to try to keep us getting our share of support around this, and we'll see that going forward. I think the openings are really a separate effort from the testing, and we hope to continue to increase the amount of tests that we're able to give, and really if we get a response back, which we're going to make sure that happens when we get a proper response in a proper amount of time, we'll be able to manage a situation better. And so we're right at the lip of the cup on being able to do that if we have an outbreak or something like that. But our efforts have always been to increase the amount of testing that we can provide.
Okay.
Yeah, I agree, Judge. That's right. Larry, would you like to go ahead and
Yes, I was going to say, I think we've had a great number of questions, and I want to stay within the time frame we always try to do for 1 hour on this. And so if we would like to have some closing comments now for Dr. Griggs, then Judge Felton, and Mayor, if you'll wrap it up.
In terms of closing comments, I would just continue to encourage our community to remember that symptoms of COVID-19 are varied. And I'm showing this because I have a close friend who saw a clinician in town. She had a cough and it was a new cough and wasn't tested. And so I'm encouraging both our general public and our medical community to be vigilant. Make sure that if you have sore throat, headache, loss of smell or taste, shortness of breath, of course, fever, and in some cases, diarrhea, nausea, vomiting that's new, particularly if those are associated with any of the other symptoms, to get in quickly and get tested. We really want to test everyone who has symptoms that even might be associated with COVID-19. In terms of our numbers of testing, there's two parts of the equation. One is those who seek care, and the other is having the care available. So while we're continuing all to build capacity for testing everybody with any symptom at all, and and I think that we are at that place or very, very close. On the other side of that equation, there is all of those who have symptoms that could indicate COVID-19. And so I would just implore our community to be sure and seek care immediately if you have any symptoms you think might be associated with COVID-19.
Judge Felton.
Judge Felton.
Okay, well, well said, Dr. Griggs, and I think it's we want a high percentage of responsibility in our community. We've had that, and there's no reason why we keep doing it. I want to point out one thing that we need to focus on that we may be taking our eye off the ball a little bit, and that is how do we get our community back economically in good shape, and a lot of that has to do with sticking to the old ball game of workforce development, job training. You know, we've got people that found out they were in an area that maybe not were working in an area that won't come back, or maybe there's too much risk in it. And so it's an opportunity to look for affordable job training, to maybe think about switching careers or even expanding their knowledge in any particular area that they're in. The other thing is we need to continue to work on economic development, recruiting in good community partners that have the same values that we have. Be sure that our community has a lot of opportunity for jobs that have not only high pay but good benefits as well. So those are the main things. And then lastly, I want to remind everyone that we are in the process of census, and we really need to get these out. This COVID-19 situation's maybe got us a little bit behind in that regard. And so be sure if you haven't done your part of the census, do it, and remind your neighbors to do that as well. It's important for us for the long term on federal state funding that we might get back here to help our community as well. Thank you.
Well said, Judge. And I was going to address that as well. I'll just say, it takes less than 10 minutes. Just go to census.gov and click on the button to fill out your census. You don't have to have a code. All you need is your address, and the census will work all that out. And it really is, as Judge said, so important both for funding and for representation in state and federal government. I want to announce that we will have a brief city council meeting at 2:00 this afternoon. The governor made a few changes in his openings on Monday, and they are effective Friday. So we need to have a brief meeting to bring our order in line with his, and we'll do that at 2:00 this afternoon. If you want to come back to this WCCC.tv to see that. Larry, thanks again to you and your staff. And Kelly Crane sitting in the back at the Health District. You all are continuing to do a fantastic job there with your contact tracing. And thank you for that, because that's obviously also a huge part of why our numbers continue to be good and where they are. And Julie, thank you and the city secretary staff for your help with these press conferences. I really want to continue to thank our citizens and our businesses for the great work that they are doing to keep us safe. As I mentioned on that call Tuesday that Judge Felton and I had with the operators of the meat processing plants, We could not ask them to be doing any more than they are doing to keep their workers safe. And I'm so impressed by that and grateful for that for our community. I want to ask you that Dr. Griggs covered this eloquently earlier, but please continue to wear face coverings in public places out of respect for others. Remember, my face covering protects you and your face covering protects me. It is not a political thing, and it just shouldn't be treated that way. Continue to take care of yourself and take care of one another. We are getting through this together. Thank you.
Well, I want to thank all three of you all, as always. I don't know how you're getting, but we're getting a lot of information from our citizens saying the fact that they greatly appreciate the straightforward answers and the good information that you all are providing. And it comes from good, strong leadership. I want to thank Dr. Griggs from the Family Health Center, Judge Felton from the McLennan County itself, and our Mayor, Kyle Deaver. And thank you so much for that. Thank you all for watching as well, and have a great afternoon.